MCQ number 1, a 28-year-old primary gravida at 38 week of gestation present with a regular painful contraction every 5 minutes. Cervical dilatation is 4 cm. What is the stage of labor? As cervical dilatation is 4 cm with regular contraction indicate the active phase of first stage of labor, that is 4 to 10 cm dilatation. So right answer is B, active phase of first stage. What is the most common cause of postpartum hemorrhage? Uterine atony is the most common cause of postpartum hemorrhage leading to the failure of uterus to contract after delivery. So the right answer is A, uterine atony. A 32-year-old woman at 34 weeks of gestation present with a hypertension BP 150 by 100 millimeter of mercury and proteinuria. What is the most likely diagnosis? Hypertension and proteinuria after 20th week of gestation are diagnostic of preeclampsia, a serious pregnancy complication. So the right answer is C, preeclampsia. MCQ number 4, what is the drug of choice for managing severe preeclampsia? Magnesium sulfate is a drug of choice for seizure prophylaxis and management in severe preeclampsia. So the right answer is C, magnesium sulfate. MCQ number 5, a 26-year-old woman at 39 weeks of gestation present with a rupture of membrane and contraction. What is the next step in the management? In turn pregnancy with PROM, that is premature rupture of membrane, oxytocin induction is initiated if labor doesn't start spontaneously within 24 hours to reduce infection risk. So the right answer is B, oxytocin induction. MCQ number 6. What is the most common cause of antepartum hemorrhage after 20th week of gestation? Abruptio placenta is the most common cause of antepartum hemorrhage after 20th week, often presented with painful vaginal bleeding and fetal distress. So the right answer is B. A 30-year-old woman at 36 weeks of gestation present with a painless vaginal bleeding. Ultrasound show the placenta covering the internal os. What is the diagnosis? So here is the keyword painless vaginal bleeding. Painless vaginal bleeding with placenta covering the internal os on ultrasound is diagnostic of placenta previa. Option B, abrupto placenta is always painful. So the right answer is A. MCQ number 8. What is the management of choice for placenta previa at term with active bleeding? C-section or caesarean section is the management of choice for placenta previa at term with active bleeding to prevent severe hemorrhage. So the right answer is C, caesarean section. MCQ number 9. A 28-year-old primary gravida present with a breech presentation at 37 week. What is the most appropriate management? External cephalic variant ECV is attempted at 37 weeks for breech presentation to rotate the fetus to cephalic position, reducing the need for cesarean section. So the right answer is A, external cephalic variant. MCQ number 10. What is the most common type of breech presentation? Frank breech flex knee extended is the most common type of breech presentation. So the right answer is B, frank breech. MCQ number 11. A 34-year-old woman at 28 weeks gestation presents with seizures. What is the most likely diagnosis? Seizure in a pregnant woman after 20th week of gestation, especially with hypertension or proteinuria, is diagnostic of eclampsia. So the right answer is B, eclampsia. What is the drug of choice for tocolysis in preterm labor? Nifedipine is preferred tocolytic for the preterm labor due to efficacy and safety profile. So the right answer is A, nifedipine. MCQ number 13. A 30-year-old woman present with absent fetal movement at 38 week. Ultrasound showed no fetal heart activity. What is the diagnosis? Absent fetal movement with no fetal heart activity on ultrasound indicate the fetal intrauterine fetal death. So the right answer is B, intrauterine fetal death or demise. MCQ number 14. What is the most common cause of polyhydramnios? Gestational diabetes is the most common cause of polyhydramnios due to fetal polyuria from hyperglycemia. So the right answer is C, gestational diabetes. MCQ number 15. A 26-year-old woman at 32 weeks of gestation present with severe abdominal pain and a tense uterus. Fetal heart rate is 180 beats per minute. What is the most likely diagnosis? As severe abdominal pain, a tense uterus, and fetal distress is tachycardia. As normal fetal heart rate range from 110 to 150 beats per minute, suggests abruptive placenta, a medical emergency. So the right answer is B, placental abruption or abruptive placenta. What is the most sensitive test for diagnosing gestational diabetes? Oral glucose tolerance test, that is OGTT, is the most sensitive test for diagnosing gestational diabetes, typically performed at 24 to 28 weeks of gestation. MCQ number 17. A 35-year-old woman at 20 weeks of gestation has a hemoglobin of 9 gram. What is the most likely cause of anemia in pregnancy? The most common cause of anemia in pregnancy is iron deficiency anemia due to increased iron demand. So the right answer is A. MCQ number 18. What is the most common cause of first trimester abortion? Chromosomal abnormalities is the most common cause of spontaneous abortion in the first trimester. So the right answer is A, chromosomal abnormalities. MCQ number 19. A 28-year-old woman present with amenorrhea and a positive pregnancy test. Ultrasound show an empty gestational sac at 8 weeks. What is the diagnosis? An empty gestational sac at 8 weeks indicate an embryonic pregnancy, belated ovum, where the embryo failed to develop. So the right answer is C, an embryonic pregnancy. What is the management of choice for a complete molar pregnancy? Suction curettage is the treatment of choice for the complete molar pregnancy to remove molar tissue and prevent complications. So the right answer is suction curettage. B. MCQ number 21. A 45-year-old woman present with heavy menstrual bleeding with anemia. Ultrasound show a thickened endometrium. What is the next step in the management? A thickened endometrium in a woman with heavy menstrual bleeding require an endometrial biopsy to rule out endometrial hyperplasia or carcinoma. So the right answer is A, endometrial biopsy. MCQ number 22. What is the most common cause of ovarian tumors? Serous cyst adenoma is the most common cause of benign ovarian tumor, often found incidentally on imaging. So, right answer is A, serous cyst adenoma. MCQ number 23. A 50-year-old woman present with postmenopausal bleeding. What is most likely diagnosis? Postmenopausal bleeding is the most concerning for endometrial carcinoma until proven otherwise. Require urgent evaluation. So the right answer is A, endometrial carcinoma. MCQ number 24. What is the investigation of choice for diagnosing endometrial carcinoma? So, for diagnosing endometrial carcinoma, gold standard is endometrial biopsy, providing histological confirmation. So, the right answer is B, endometrial biopsy. MCQ number 25. A 30-year-old woman present with pelvic pain and dysmenorrhea. Ultrasound show a chocolate cyst in the ovary. What is the diagnosis? A chocolate cyst, that is hemorrhagic cyst on ultrasound, is a characteristic of endometrioma associated with endometriosis. So the right answer is A, endometrioma. What is the most common cause of cervical cancer? Squamous cell carcinoma is the most common cause of cervical cancer associated with human papilloma virus infection. So the right answer is A, squamous cell carcinoma. MCQ number 27. A 25-year-old woman present with primary infertility and irregular menses. Hormonal evaluation show a elevated FSH ratio. What is the most likely diagnosis? Elevated LH-FSH ratio with irregular menses and infertility is a characteristic of PCOS. So the right answer is A, polycystic ovarian syndrome. MCQ number 28. What is the drug of choice for ovulation induction in PCOS? Clomiphene citrate is the first line drug for ovulation induction in PCOS, stimulating follicular development. So the right answer is A, clomiphene citrate. MCQ number 29. A 40-year-old woman present with a pelvic mass C125 is elevated and ultrasound show a complex ovarian cyst. What is the most likely diagnosis? A complex ovarian cyst with elevated CA125 in a 40-year-old woman is highly suggestive of ovarian cancer requiring a surgical evaluation. So the right answer is B, ovarian cancer. MCQ number 30. What is the most common cause of abnormal uterine bleeding in adolescents? Anovulatory cycle, the most common cause of abnormal uterine bleeding in adolescents due to immature hypothalamic pituitary ovarian axis. So the right answer is A, anovulatory cycles. MCQ number 31. A 35-year-old woman with a history of recurrent miscarriages, what is the most common chromosomal abnormality associated with the recurrent pregnancy loss? Balanced translocation in one parent is the most common cause of chromosomal abnormality associated with the recurrent miscarriages. The right answer is B, balanced translocation. MCQ number 32. What is the most common site of endometriosis? OV is the most common site of endometriosis, often leading to endometrioma or chocolate cyst. So the right answer is A, ovary. MCQ number 33. A 28-year-old woman present with acute pelvic pain. Ultrasound show a ruptured ovarian cyst. What is the most likely type of cyst? Corpus luteal cysts are prone to rupture, causing acute pelvic pain, especially in the luteal phase of menstrual cycle. So, right answer is A. Corpus luteal cyst. What is the more MCQ number 34? What is the most common cause of hirsutism in women? PCOS, polycystic ovarian syndrome, is the most common of hirsutism due to hyperandrogenism from ovarian dysfunction. So, the right answer is A. Polycystic ovarian syndrome. MCQ number 35. A 50-year-old woman present with hot flashes and irregular menses. What is the most likely diagnosis? Hot flashes and irregular menses in a 50-year-old woman are typical of menopause, marking the cessation of ovarian function. So the right answer is A, menopause. MCQ number 36. What is the most effective contraceptive method? Sterilization, that is tubal ligation in female, or vasectomy in male is the most effective contraceptive method with a failure rate of less than 1%. So right answer is D, sterilization. MCQ number 37. A 30-year-old woman present with a breast lump, ultrasound show a well-defined mobile mass. What is the most likely diagnosis? So here is the keyword is well-defined and a mobile mass. A well-defined mobile mass is always a fibroadenoma, that is a benign tumor. So the right answer is A, fibroadenoma. What is the most common cause of secondary amenorrhea? Pregnancy is the most common cause of secondary amenorrhea, that is a physiological secondary amenorrhea, and must be ruled out first. So the right answer is A, pregnancy. A 25-year-old woman with a foul smelling vaginal discharge, wet mount show, clue cell. What is the diagnosis? So here is a keyword are clue cell and age 25 year, that is sexually young female with a greenish vaginal discharge is always a diagnosis of bacterial vaginosis caused by a bacteria Gardnerella vaginalis. So the right answer is A, bacterial vaginosis. What is the most common choice for bacterial vaginosis? Drug of choice. Drug of choice for the bacterial vaginosis is metronidazole targeting anaerobes. So right answer is A, metronidazole. What is the most common cause of ectopic pregnancy? Anything that affect tubes that obstruct the travel of ovum from ovary fallopian tube to uterus lead to a ectopic pregnancy. So PID, pelvic inflammatory disease causing tubal blockage, scarring, increased risk of ectopic pregnancy. What is a hallmark of ultrasound finding in molar pregnancy? Snowstorm appearance is the characteristics of molar pregnancy on ultrasound due to vesicular tissues. Question number 43. What is the most common type of uterine fibroid? Intramural fibroid located in the myometrium are the most common type. Question number 44. What is the treatment of choice for severe postpartum hemorrhage due to uterine atony? Oxytocin is the first line drug to promote uterine contraction in postpartum hemorrhage. Question number 45. What is the most common cause of oligohydramnios? Fatal renal anomalies such as bilateral renal agenesis reduce amniotic fluid production, leading to oligohydramnios. Question number 46. What is the investigation of choice for cervical cancer screening? Pap smear is the standard screening test for detecting cervical dysplasias or cancer. Question number 47. What is the most common symptom of endometrial carcinoma? Postmenopausal bleeding is a hallmark symptom requiring urgent evaluation. What is the most common cause of preterm labor? Intrauterine or systemic infection are the leading cause of preterm labor. What is the drug of choice for treating eclampsia? Magnesium sulfate is used for seizure control and prevention in eclampsia.